So we have the results of the phase 1 trial of a novel bispecific that's targeting BCMA and CD3 in patients with relapsed refractory multiple myeloma. As you know, there are a lot of new immune therapies that are being developed in multiple myeloma, including bispecific agents targeting BCMA as well as other antigens, and also CAR T cell therapies that are targeting these. Now, the TNB-383 or ABV-383 is a novel bispecific that targets the BCMA on the myeloma cell. This is a first-in-human study with dose escalation using the 3+3 design with some dose expansion at the recommended phase 2 dose. The study has already accrued 118 patients who have been treated, and 75 of those 118 patients have received 40 milligrams or more of the 383 dose. The specific update is looking more so at the patients, the 75 patients who received the 40 milligrams or higher dose. The 383 is given intravenously over 1 to 2 hours, once every 3 weeks. The patients who were enrolled on the study were very heavily pre-treated with a median of 6 prior lines of therapy. Two-thirds of the patients were triple-class refractory. Overall, the treatment was well tolerated. Adverse events of some kind or other were observed in over 50% of the patients. The hematological toxicities were seen in about a quarter of the patients, mostly neutropenia. We did see cytokine release syndrome in almost two-thirds of the patients, but they were mostly grade 1 or grade 2. There were very little in terms of neurological toxicity. There were about a third of the patients who did have some infection or other, but again, not too unexpected given this highly advanced myeloma that we are treating. In terms of efficacy, we saw an overall response rate of about 81% among the group of patients who received 40 milligrams or more, who were in the dose escalation phase, meaning they had a median of almost 8 months of follow-up. Now, if you were to look at all 75 patients who were in the 40 milligrams or higher dose in the escalation and the expansion phase with a median of about 4 months of follow-up, the overall response rate was about 53%. We fully anticipate that many of these patients will increase their depth of response given that two-thirds of those patients are still on therapy. Now, amongst the triple-class refractory patients, over 50% of the patients also responded to treatment. Currently, the trial is ongoing with the remaining two-thirds of the patients being treated at 60 milligrams every 3 weeks. The cytokine release syndrome, as I mentioned, was relatively uncommon. It did not recur in any of the patients except one where the dose was increased. And almost a quarter of the patients needed some form of treatment, either tocilizumab or steroids, for treatment of the CRS. And we did see more CRS at the higher doses. So overall, it appears to be quite an effective therapy in a highly refractory patient population with very manageable toxicity and mostly low-grade cytokine release syndrome.